Hi, my name is Dr. Story, and I've been a doctor of chiropractic for over 22 years. There are some chiropractors, it seems as though they have 800 videos of them adjusting patients, and if you notice, they're doing the same adjustments on every patient. Now, to me, in my humble opinion, I don't understand this, and I'm a chiropractor. I don't understand how you can do the same adjustments to every patient, no matter what their condition. There are videos where patients have neck pain, back pain, sciatica, they have different conditions in their extremities, and the adjustments seem to be the same thing no matter who the patient is. I don't understand this. This doesn't make any sense. To me, this would be like going to a medical doctor, and whether you had a viral infection, a bacterial infection, a fungal infection, the doctor just gave you penicillin, no matter what. Or if you went to a surgeon and it didn't matter where you hurt in your body, the surgeon just did the same surgery to everyone. In chiropractic, the best way to practice chiropractic, in my humble opinion, is to analyze the person's body and only do adjustments where it's absolutely necessary to make a correction so their body can actually function better. This is how I've been practicing chiropractic and how a lot of my colleagues in this town practice. Now, occasionally there's one or two that will kind of do the same thing, and usually you could see that from a mile away. They have the treatment rooms. There's only one treatment room, and there's a lineup of tables. And if you just sat there for 20 minutes, you see them seeing 20 different patients, and they do the same treatment to everyone. This isn't just how I want to practice. Number one, I don't think it really makes as big of a difference as we would hope. In chiropractic school, there was what's called the Flying 7, which there were 7 adjustments that chiropractors would do that in theory would help 80% of the population. And these are mainly postural adjustments. Adjustments where you would correct a cervical curve, you would raise their chest, you would adjust their sacroiliac joints. And this was called the Flying 7 because you could really fly through those 7 adjustments. And the idea was that you could see a tremendous amount of people in 1 hour. So literally a person could see 30, 40, 50 patients in 1 hour. And that of course benefited the chiropractor because you could make more money that way. In addition to that, it didn't take a long time for the patient to receive the treatment, so it didn't require a lot of their time out of their day. So the thought process was that that was a win-win. I've just never met any chiropractors that actually do that, other than when I started watching YouTube and realizing that, wow, there's people that do this. So I don't really think that's great, because if that helps 80% of the people, well, what about the other 20%? Those are the people that I want to help, and those are the people that I think that would benefit from specific chiropractic adjustments. Now, the other thing is, intellectually, I'm kind of a thinker. I like to think through problems. I like to solve difficult cases. And what ends up happening is, if I just were to do the same treatment on every single patient, regardless of whether they had neck pain or back pain or hip pain, sciatica, whatever the case may be, that would be somewhat professionally boring for me to do. I don't want to just pull on someone's neck with a towel on every patient. I don't think that's a great idea. So the thing is, intellectually, as a chiropractor, I like to problem solve and see what's going on with patients and actually make specific corrections. What's interesting is probably the most popular chiropractor on YouTube was Dr. Ian in Australia, and he practiced Gonstead much in the way that I practice Gonstead. I've been practicing Gonstead for my entire career. I do other things as well, but Gonstead was primarily, when I came out of school, what I focused on. That's all I did. And Dr. Ian would do these adjustments on patients, and he'd adjust 1, 2, maybe 3 different areas and get just tremendous results. And it's kind of interesting that most people didn't even know, well, what is this? What is this form of chiropractic? I've never seen this before. And it was just kind of funny because it was like, well, that's what chiropractors do. This is what we do every day. You know, it sounds cocky, but the thing is that we get miracles in our office every day, and it's just kind of normal. Now, we don't get that on every patient 100% of the time in every case, but it's not uncommon to have patients walking out just going, holy cow, no one's ever done that to me. So I feel as though probably the best way to approach chiropractic is intellectually to think of what is going on with the person's body, make corrections. Every patient is unique and different, and thus every patient should be treated uniquely and differently. So if you think this is interesting, let me know what your opinion is. Do you like to be adjusted all over, or do you like someone to analyze the body and just make specific corrections? There's really no right answer here, so leave your comments in the comment section below, and I'd be very curious to find out what you actually think. So give me a thumbs up, let me know you're subscribing, and talk to you later.